The rise of the COVID-19 Omicron variant means it's vitally important to consider getting a vaccine booster shot to protect yourself and others. Here's what you should and shouldn't do after getting your COVID-19 booster. If you sailed through your last COVID-19 vaccine without experiencing a reaction, you might be tempted to head straight out the door after receiving your booster shot. For the majority of people, that idea might be perfectly okay. However, as many state health departments, including Oregon Health Authority, have explained, you should still plan on waiting 15 to 30 minutes after getting your booster, much like you did after your initial vaccination. According to Beth Moore, the interim chair and professor of microbiology and immunology at Michigan Medicine, after their jab, most people will be asked to sit and wait a 15-minute observation period to watch for rare allergic reactions. Those with a history of serious allergic reactions should prepare to wait up to 30 minutes. Reactions have ranged from hives to anaphylactic shock and are quickly treated with Benadryl for a mild reaction or epinephrine for anaphylaxis. Though your body's reaction to the COVID-19 booster shot will likely be similar to its response to the primary series, according to CNN, don't take it for granted. With mixing and matching COVID-19 boosters with COVID-19 vaccines, there's the possibility for a few more side effects to occur. But it's nothing to be overly worried about, according to healthcare professionals. When you mix and match vaccines from different manufacturers, you could experience a different reaction afterward. That's according to Dr. Charlotte Baker, a professor of epidemiology at Virginia Tech, who said, "What may be happening is that the roadmap your body had for the first vaccine is a little different with a changed vaccine. The new vaccine has to teach it a few more things, so you may get new side effects. The vaccines all are trying to do the same thing, but each has their own way of doing it." If you had a bit of a headache, a mild fever, or some muscle aches with your last vaccine jab, it's pretty tempting to pop an Advil or Tylenol before your booster in preparation for the discomfort. But don't do it. Over-the-counter anti-inflammatory and fever-reducing drugs like Advil and other NSAIDs could reduce your immune response if you take them before receiving the vaccine. According to GoodRx Health, while we don't have any studies on how OTC pain relievers affect your immune system's response to the COVID-19 vaccine, we do have some research that was done with other vaccines. In short, pain relievers might cause a weaker response to the vaccine. This can possibly make the vaccine less effective. The CDC advises holding off on taking antihistamines before your COVID-19 shot for the same reason. But here's the good news. The experts agree it's perfectly fine to use those over-the-counter medications after your appointment. Per the CDC, you can take these medications to relieve post-vaccination side effects if you have no other medical reasons that prevent you from taking these medications normally. It is not recommended you take these medicines before vaccination for the purpose of trying to prevent side effects. However, the agency advised that you should not stop taking medications if you need them for underlying medical conditions. Listen to your body. Although there's no harm to exercise, don't be a hero if booster side effects hit you hard. Take a day off from your high-intensity cardio workout and do something less grueling like walking or gentle yoga and stretching, per Medical News Today. The experts at the Cleveland Clinic agree that exercising is great for your body. According to them, some evidence shows that people who maintain healthy lifestyles and exercise regularly seem to have enhanced responses to vaccines. However, don't overdo it immediately after your booster shot if you're not feeling up to it. Allow your body some time to recuperate, the Cleveland Clinic advised. You might find that after you get your shot, it could be a good day to just rest or do something less strenuous, like just taking a walk. Recovery is part of exercising too. It's not a bad thing to have a lighter workout day. So you got the booster and now you're meeting up with friends to celebrate? If you're planning on swigging back a few cocktails, just make sure the party doesn't get out of hand. Dr. Natasha Bouillon, a family medicine specialist and clinical assistant professor at the University of Arizona College of Medicine, Phoenix, had this to say about alcohol and the booster shot. She told Arizona Republic, "A toast to celebrate the COVID vaccine is fine, but in general, too much alcohol can impact our immune system. Alcohol is dehydrating and can exacerbate the post-vaccine symptoms people may feel, such as muscle aches or fatigue. Ideally, Dr. Bouillon recommends waiting 48 hours after your appointment." Dr. Mark Loafman, chair of family and community medicine for Cook County Health, told NBC Chicago, "We know in general that people who have used alcohol, excessive doses of alcohol, have a weakened immune system, and that makes them more susceptible to infection and may weaken their response to a vaccine."
A 2015 study found that just one episode of binge drinking had short-term effects on the immune system.
Should you rush out for fresh ink right after getting your COVID-19 booster? As it turns out, there's really no hard and fast rule to put it off, but you should use some caution. Dr. Michael L. Chang, pediatric infectious disease specialist at McGovern Medical School at UT Health in Houston, shared some of his advice on the topic to Allure, saying, "Based on how the various vaccines work, whether mRNA or adenoviral vector-based, there isn't any reason to think getting a tattoo would influence how well the vaccines work, but a local infection after a tattoo may need antibiotic therapy, and you don't want to blow it off and blame the vaccine. It's best to wait at least a couple of days after your vaccine or booster, especially if your new tattoo is going to be near the injection site. Otherwise, you could end up being sore in your arm for two reasons at once." A lot of people have a fear of needles, including about 76 million Americans. This likely contributes to some of the vaccine hesitancy. If you have trypnophobia and it's holding you back from not only a COVID-19 vaccine, booster, or other crucial shots, you may want to consider scheduling all of your inoculations in one visit. One and done. Combining appointments will also save you both time and unnecessary distress. Dr. Gila Beckerman, a pediatrician with extensive vaccine experience based in Delray Beach, Florida, told the Sun Sentinel, "Each vaccine works by making antibodies to a specific protein found on that virus or bacteria. When you get the COVID vaccine, your body makes antibodies specifically against the spike protein on the outside of the COVID virus. Those antibodies don't affect a different virus or bacteria. This means you can get multiple vaccines at once. You have probably already received lots of vaccinations together." Dr. David Buchholz, senior founding medical director for primary care at Columbia Doctors in New York City, explained as much in a Q&A with the Columbia University Irving Medical Center. According to the doctor, at 2 months of age, we immunize infants against 8 different diseases with minimal or no side effects, and it's convenient to get shots together so you don't have to schedule multiple visits. Suffice it to say, a lot of us would love to ditch the mask. However, the medical community agrees that masks are a necessary tool to reduce transmission. Dr. Angela Branch, Associate Professor of Infectious Diseases and Co-Director of the Vaccine and Treatment Evaluation Unit at University of Rochester Medical Center, explained, "While being fully vaccinated is very effective at preventing severe illness and death, and boosters are about 90% effective at preventing symptomatic infection, there is a small possibility of having a mild or asymptomatic infection. As such, she advised wearing a face mask indoors in public areas. While getting a booster means you're much safer from severe complications, the disease remains contagious, both to you and others, so you should continue to adhere to the established safety protocols, especially indoor mask wearing. Even if you're fully vaccinated and boosted, you still need to get tested if you've had close contact with someone who has recently received a positive result, or if you develop symptoms yourself. Be aware that some people, including infants and children, may not even show any symptoms, but can still carry high levels of virus and transmit it to others, per research reported in the Harvard Gazette. Since the Delta variant came on the scene, evidence has shown that even if you're vaccinated, there is a chance you can get a breakthrough infection and spread the virus to others. According to Harvard Health Publishing, a person with COVID-19 may be contagious 48 hours before starting to experience symptoms. People may actually be most likely to spread the virus to others during the 48 hours before they start to experience symptoms. If you learn you've been around someone with COVID-19, don't think you're in the clear just because you've had your COVID-19 booster shot. You still need to get tested. You may not realize this, but even if you've just received a COVID-19 vaccine or booster shot, you can donate blood, in most cases, right away without any waiting period. Additionally, giving blood does not reduce your protection against the virus. WebMD explained that when you donate a pint of blood, you lose about 10% of the total blood in your body. According to the website, if you've had the COVID-19 vaccine, your antibody levels won't go down after you give blood. Your immune system will quickly replace the antibodies. If you're feeling healthy, have not been infected recently, and you received an FDA-approved or FDA-authorized COVID-19 vaccine or booster, the American Red Cross says they'd love to have you make an appointment to stop by. The organization, as well as others like it, are in desperate need of blood, platelet, and plasma donations. The situation is worse than you may expect, and your blood could make a difference. According to the Red Cross website, the Red Cross is experiencing the worst blood shortage in over a decade. The dangerously low blood supply levels have forced some hospitals to defer patients from major surgery.
It's the start of the coronavirus crisis. Some 7,000 Red Cross blood drives have had to be canceled, resulting in more than 200,000 fewer blood donations.
If you want to donate after receiving the vaccine, just bring your vaccination card to verify the vaccine manufacturer. You don't have to wait to do it, and you might just save a life. Congratulations, you've got the superpower of the booster. The third shot in the vaccination regimen gets your body back into prime condition to fight infection, severe disease, and greatly reduce your chances of hospitalization from all known variants of COVID-19. But just because the vaccines are out doesn't mean the struggle is over. And just because you have the vaccine doesn't mean you're immune from the virus. New variants continue to emerge and spread, such as Omicron, which is sweeping through populations faster than previous variants, according to warnings by the World Health Organization. Dr. Marcus Pereira, assistant professor of medicine in the Division of Infectious Diseases at Columbia University Vagelos College of Physicians and Surgeons, says there are many compelling reasons to get a booster shot, because even if it doesn't make you immune to the virus, it will substantially change the outcome if you do become infected. The doctor told Columbia University Irving Medical Center, reassuringly, it seems that booster vaccine doses can significantly improve protection against Omicron. Most experts think that breakthrough infections should lead to milder symptoms. Dr. Malika Marshall, a board-certified physician in internal medicine and pediatrics and a medical reporter at Boston's WBZ News, explained that people who are vaccinated are far less likely to get COVID-19, but they can still transmit the virus to others if they do get a breakthrough infection. This is why, as she explained, it is vital for vaccinated individuals to still act with caution and for everyone to get vaccinated and boosted as soon as they can. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest COVID-19 developments are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.